Today, I want to welcome Justin Leader. I've known Justin for several months now and been looking forward to this interview. And for those that know me, you know I spent 3 months in the hospital and it was not a glowing experience. And I've discovered somebody challenged me once last year and they said, Craig, you need to reach out and find some of the people that are doing the right things in healthcare. They're out there and you need to find them. And Justin's one of the first people that I talked to. And in 2014, he established Benefits DNA. It's an objective, independent health and welfare benefits consulting firm. They provide compliance oversight, actuarial services, cost mitigation strategies, and traditional broker services to group health plan sponsors. Now, it's a mouthful, but Justin is part of the solution. And there's a handful of people around this country, and we're trying to interview them on Leaders and Legacies. Justin is one of the ones that's being a part of the solution. So I want you to listen in because this will give you hope. Justin, welcome.
Thank you. Thank you for having me. I'm honored to be here, Craig.
So, we met through a mutual friend, Matt Zahn. We've both been on his podcast. And he introduced me to you, and then I discovered that Kirsten, you're in her Vistage group, and I was like, oh my goodness, this is such a small world.
Oh my gosh, yeah. And I love the time on Matt's podcast, and Kirsten has helped me so much personally and professionally the last few years in working with her. I'm eternally grateful, if you will.
Yeah. Well, she's also been on Leaders and Legacies. Matt's been on Leaders and Legacies. But part of the reason that I really wanted to talk to you is obviously you're passionate about fixing things. And and I read a little bit from your bio, and it has, and some of that's just kind of gobbledygook. What's the you had an experience that really resonates when you show up for work. There's a name and there's a face that drives you.
Well, a lot of folks have heard me talk about my Aunt Gwen, but it's a culmination of a couple different faces, right? I shared with you my experience of being adopted by my grandfather, my great-grandmother. One of the things that they echoed in my head as an early age was do the right thing. And so, we fast forward years later, I'm working in this industry. There's a lot of things that I see wrong with it. It's part of the reason why I couldn't stay in the pharmaceutical business or working for a big bank. I have this thing with ethics and justice. And if I see an injustice, like I want to fix it. But my Aunt Gwen, sweetest lady in the world, she worked off the Bedford Turnpike interchange in Pennsylvania at a Denny's. She raised her kids on, waitress tips and working her tail off, and then, took care of her grandkids too. But like many Americans, she has this issue with her health plan. And what do I mean by that? Well, employers in this uniquely American scenario offer this thing called health and welfare benefits. And it's the second largest overhead expense that they have, second largest line item on their P&L. And they get really, really bad advice. And we can get into all that. But my Aunt Gwen, she falls victim to what most of Americans have happened to them. They can't afford time off work, and they can't afford their out-of-pocket expenses because she was in a high deductible health plan. She's in a high deductible health plan. Why? Because the premiums are low. She needs all that money in her paycheck. So she ignores a bunch of symptoms for a period of time. She collapses at work. She goes to the hospital and gets diagnosed with stage 4 cervical cancer. She picks up the phone, calls me and says, Judd, that's what my family calls me, Judd. Not how can I beat this? She asked me, how can I afford this? And therein lies the problem. We live in one of the greatest countries, one of the greatest developed nations on the planet, but we spend $4.5 trillion on healthcare. Our quality outcomes are ranked somewhere in the mid-30s for developed nations. Like, that's problematic. So we pay a lot for really crappy value. And unfortunately, my aunt didn't know what her rights were when it came to even accessing not-for-profit facilities that are required to provide care to people in her demographic. And it's not just her demographic, it's like 70% of America are eligible for programs that these hospitals are required to provide because they don't pay any taxes. So long and short is she died a few years later from that cancer. And I have to question, could we have prevented it? Could she be in a scenario where she could see a doctor and be able to afford time off work? And that's what we're trying to fix, one plan at a time across this country, and then take it a step further and educate other people on how to do the same thing, even if they're a competitor of ours, and go down to DC and champion this legislation that furthers the issue of transparency. So, yeah, to sum it up, I'm very passionate, and I think about those people that have been impacted, and some, I would argue, possibly killed by the system. And you're familiar with that.
Yeah. Yeah. It's, and my wife and I have been really clear. We believe it's nothing short of a miracle that I'm alive. And you talk about, you talk about justice. One of the things that just enrages me, and this, and this is where I have a high skepticism of government, because when we passed the CARES Act, we gave the doctors broad sweeping immunity.
Hmm.
And they did a number of things that, in my mind, were criminal, at least criminally negligent. For instance, there was a drug they gave me. It's remdesivir, and they gave it to me on August 10th, 2021. That was when I got my first dose. At that point, almost over a year earlier, the Lancet had released a study showing that remdesivir was ineffective in the treatment of COVID. 10 months before they gave me that dose, the World Health Organization came out and said that remdesivir was ineffective in the treatment of COVID, so don't use it because it has risks. Multiple studies showed that the risks were it would damage your kidneys. And so they gave me a drug that had multiple studies had shown it was ineffective in the treatment of COVID. Multiple studies had shown that it would damage the kidneys. They never told me that. And from what I can tell, the only redeeming trait of that drug was on that day, August 10th, 2021, it was one of 3 drugs that that CMS.gov, the government website, listed that if a doctor prescribed that for the treatment of COVID, they would give the doctor a 20% bonus.
You talk about misaligned incentives. Our healthcare system, chock full of them. Uncover them every day. But that was your life, man.
It put me in, within 10 days of my final dose, I was in kidney failure. I was on dialysis.
Wow.
It's a miracle that I lived. And when we passed the CARES Act, we gave doctors broad sweeping immunity, because I actually reached out to some attorneys, because not because I was looking for a payday, but I was like, we have to stop this. And you know what the attorneys told me? We're not going to take your case. It's a hard case to prosecute, and you lived. Still have kidney issues. But that's that justice that I appreciate that I see in you, and I see in some of the people that you hang out with, is you're passionate about fixing these things.
And just to go back to your earlier comment, I think the government is too conflicted in a lot of this. There's a lot of money.
Yeah.
There's a lot of walk around money, right? Funding. And then 2, I don't think they understand how bad it is.
Interesting. Explain that.
There's a disconnect. You think about congressmen, senators, they live a very different life than John Q. Public. I grew up as a chip kid. I was on Medicaid.
Yeah.
Thankful for that program, right? Otherwise, I wouldn't have had health care. So you think about those folks, not to say they're in an ivory tower, regardless if you're on one side or the other, but there is a disconnect. And then there's a lot of misinformation. You drive down the highway, you see billboards about the best care in this region, and you turn on the TV. We're one of the only developed nations that allows direct marketing of pharmaceuticals to patients.
One of two.
The other one's, I think, New Zealand.
Yep.
Right? we also have no pricing constraints on what can reasonably be charged for any medication or service. So now you have the TICRA law that passed, hospital transparency law that passed, the Consolidated Appropriations Act. But where is the accountability? You know, I grew up listening to a lot of punk rock.
So what punk rock groups did you like?
Yeah, so I like the Sex Pistols. These were actually the first three albums that I had in middle school. Sex Pistols, Rancid, and No FX. And the Sex Pistols was Nevermind the Bullocks. Rancid was And Out Come the Wolves, that album, and then No FX was Punk and Drublick. And then it just went downhill from there. Like I was obsessed.
Wow. Yeah. And, you know, Johnny Rotten's still making the rounds. You see him pop up and make a comment here and there. He's not as sprite as he used to be, but he's still out there.
No, no, they're all aging. You know, some better than others, but you think about that, like hell, it's amazing that the guys from the Rolling Stones are still alive.
Yeah. 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 They're like the worst anti-drug use commercial ever.
Yes, yes.
So I love Offspring. And the thing that blows me away about Offspring is when I listen to their lyrics, I'd be like, I want my kids listening to this because all of a sudden become punk to have a job and live a responsible life and have self-esteem.
Yeah, 100%. And that's what I mean. I think what I love most about music in general, and I listen to everything, man. I mean, I was cheering for Jelly Roll last night at the CMT Country Music Awards. Is it's storytelling and it's heart and passion, and I can get enthralled in those lyrics and understand why they're passionate about, you know, any number of topics. And that goes across all genres of music. But for punk rock, they were really, you know, fighting something. They were fighting the status quo in the system. And for me, who was kind of lost as a youth, trying to figure things out, you know, I felt that.
Yeah. So now, yeah, you're kind of living out that punk, you're fighting the status quo because let's be honest, healthcare is a behemoth.
Mm. It's exhausting. Not just a behemoth, it's a $4.5 trillion behemoth. And there's a lot of misaligned incentives, and we're trying to do things above board and transparent and the right way. And I understand why people don't enter into this business in the way that we have, because there's a lot of status in the status quo. A good attorney friend of mine, Karen Handorf, partners with Julie Selesnik and Arissa. She came out and said that. I'm like, Karen, you're right. You're right. We could make a lot more money if we did things like everybody else and hid all these fees and commissions, but it doesn't help fix the underlying root of the problem, which is transparency. We're not in a capitalistic system because we have no idea what the hell we're paying for. There's no way for us to understand and create a competitive market the way it is now, but we're trying.
Well, and part of the capitalistic system is that you can go in and you can ask for things that are reasonable. And so I actually have recordings of my family asking the doctors to put me on vitamins when I was on the ventilator. And no kidding, the doctors said, well, if we give him vitamins, we'd have to give everybody else vitamins.
Yeah.
Like, and vitamin D was one of the most effective treatments against COVID. But from what I can tell, and I don't have 100% confirmation, but I have pretty close. They had a protocol, they had an FDA protocol that they had to follow. As long as they followed that protocol, they got 20% bonuses on everything they did. And if they departed from that protocol, as far as I can tell, I don't, and again, I want to be very careful. I don't have 100% confirmation on this, but from what I can tell, if they departed from that protocol, they lost their bonus.
I'm not surprised, right? There are so many programs out there that drive bonus structure on performance and that don't have a lot of basis from patient to patient. Hell, we're named Benefits DNA because every single plan that we touch has its own unique DNA.
Yeah.
What works for one patient might not work for another patient, you know, but unfortunately, that's how people are incentivized. Take a look at the hospital systems that have purchased primary care practices. You know, PCPs are going the way of the dinosaur, the independents. Why? Because, well, primary care physicians, they're ground zero to be able to refer upstream for unnecessary tests. You know, MRIs, X-rays, blood work that really has little to no value in some of these situations, but it's a big revenue driver for a hospital. I get an argument with a local hospital CFO once. He's like, yeah, I know I could charge a couple $100 for an MRI, but if I can get 10 grand from a plan, I'm gonna get 10 grand.
Yeah.
Right? That's just, it's wild to think about that.
Well, let's talk about this transparency. Where do costs get hidden?
Everywhere. And I hate to say that, but if you look at, if okay, let's talk about a claim in general. I go seek care, right? Providers are taught classes on how to upcode and charge for maximizing reimbursement. So I go in for a preventative care. If I happen to mention that my elbow's sore, boom, game on. It's no longer preventative. We're going to code it for something else. And then as that claim makes its way through the food, through the up the ladder, you know, there's a number of things that can happen before it's paid, but ultimately plans are paying exorbitant amounts for little to no value. The whole idea of a discounted network has been proven time and time again that it's just a bunch of malarkey. The only way for let's take an insurance carrier network, for instance. What is it? It's a discounted contractual network. That's where we're going in. We're supposedly getting a better deal, but if we don't know the starting price, we don't know that we're getting a good deal. It's like me saying I'm going to sell you a new car, and you're going to get 50% off, and maybe the starting price is $1 million for a $100,000 car. Is that really a good deal? You're overpaying by 400K in that scenario. So case in point, when we hire an insurance carrier and administrator, they should be adjudicating claims and you should be getting a discount. The issue and what has come out of the Consolidated Appropriations Act is now, as a plan sponsor, if we enter into any contract that contains verbiage that prevents me from understanding cost, quality, and utilization, that's known as a gag clause. And all of these carriers and vendors are saying, Mr. and Mrs. Plan Sponsor, we got you. We're going to attest on your behalf that there's no gag clauses in our contract. And the DOL allows that because they're knuckleheads. And they should be going after these people for attesting on things that are not true. Because as soon as I come in representing my client, or my client writes a demand letter to these entities asking for information, even though they sign these forms saying there's no gag clauses, you know what they say, Craig?
What?
No, go pound sand. That's proprietary information. But when we get data, we can prove time and time again, there's upcoding, there's unbundling, exorbitant charges. We're not getting that discount that you're reporting that we're getting, right? So it's all a facade and it's built on a house of cards, but we're exposing it little by little. But it's not without a fight. I mean, I have people that start my car now in the morning just because we're bucking the system and fight. I'm joking, but you know, it's
No,
that crazy to think about.
I believe that. I mean, I believe that the forces, the forces behind it are just insanely powerful. And I think the number, when you were talking about how the United States and New Zealand are the only two I think they're the only two countries in the world, not just developed countries. I think they're the only two countries in the world that allow pharmaceutical advertising on TV. If I remember correctly, 72% of advertising revenue comes from pharmaceuticals.
It's some asinine number like that. I mean, it's just wild. When I sold a blood pressure medication, it was a $2 billion drug. We had like 6 competitors in the same class. And it was like the third or fourth therapy that you should be trying to control your hypertension. And I'm like, man, this is insane. But we were handing out free coupons like candy to make the copay that the equivalent of a generic for the consumer. But what do you think it was charging the health plan on a monthly basis on back end? A couple $100. When the frontline generic alternative was like pennies on the dollar.
Yeah.
So I'm not trying to listen. I'm a science guy. My undergrad was biology, chemistry, pre-med. Like I appreciate science and advancement. But let me tell you a story. I got a call the other week. Somebody gave this guy my contact information. He's not a client. He's not one of the members on a health plan I represent. but he called me and he said, "Hey, I heard you might be able to help. My 4-year-old son just got diagnosed with Duchenne's muscular dystrophy. And the drug they want to put him on is $7,000 a month.
Wow.
And the genetic therapy that could help prolong and extend his life, which is approved for his age, is $3.2 million. And I don't know where to start."
Oh my goodness.
So, father to father, I got 2 boys at home. You know how heartbreaking that is to think about that? You know, your kid just gets handed essentially a terminal illness, right? And your only hope to keep him alive is $3.2 million or 7K a month. Now, there's organizations out there, there's charities, there's all this other crap, but like, you think we would invest more in helping people understand how to navigate the system? But it's not just that case. I mean, we have instances where we help somebody, save $80 a month on a prescription drug or a couple drugs that they're taking. And that woman cried because if you annualize that, $80 a month for her when she's just struggling to put food on the table and pay her rent and take care of her kids, that's a lot of money.
That's a significant part of her income.
When you're barely making, 25 grand a year, 30 grand, hell yeah, it is.
Yeah. Wow. Something I ran into, and I think maybe this ties into what you're talking about. So I have a sensitivity to developing chalazions, which is basically a big bump on the eyelid. And when you see one, anybody that knows what they are knows exactly what it is. They're like, hey, it's a chalazion. We need to lance it, drain it, and you'll be good. I have one, and so I'm on a high deductible plan. And so called. I called 3 different clinics. And the first one I called, I said, how much? And they're like, well, you first need to come in for for a consult. I'm like, you're kidding. It's a Schlazion. This is your business. When you see it, you're going to say it's a Schlazion, lay back. We're going to lance it. You're going to be good. And they eventually came back. They said, hey, it'd be $350. I call another place. I could never get a quote out of them. They were, and they were even more rigid. They wanted me to come in. They wanted to do all these things. And I said the same thing. They're like, no, we can't do that. But when I started questioning them, I got in my head that probably going to them would cost about $800. And so finally, I called a third place and they also say, hey, you need to come in for a consult. And I'm like, come on, give me a break. They're like, yeah, okay. Come on in. We'll do it. I got a half hour with the nurse. I got 45 minutes with the surgeon. And I got a follow-up visit with the surgeon it was like $250.
Amazing.
And when I thought back to it, that one place that I think was around $800, I realized they've built a machine to milk the insurance companies. They're an insurance extraction machine.
It's called maximizing reimbursements, my friend.
All right. So so what is that? And how come we don't see this more often? How don't recognize it when it's happening?
Because it's what we're used to. We're used to having a card in our pocket that has one of maybe 4 logos: Blues, United, Cigna, and Aetna, the Bucas. And we go in and we fall victim to what we think the system is or how it operates. It's crazy. It's like a form of Stockholm syndrome. We just accept it and take it on the chin. I think we're reaching a boiling point where people are getting pissed off and they're demanding more, especially post COVID. But if you grow up inside a box, you don't know that there's a box. Once you step outside of the box, I say this all the time. If you're a Ted Lasso fan, the psychiatrist says a great line in that show. She says, Ted, the truth will set you free, but first it'll piss you off. You
Yeah.
get really pissed off when you realize how things could be. So you see direct primary care, practices booming up, or concierge medicine, where you can go in and actually talk to a physician for 30 minutes. You can
Yeah.
have an actual consult. Like, that's the way it should be. But, in order for a lot of these folks to survive and to get paid, they have to see so many patients, they have to do so many procedure services, blah, 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 blah. And it creates this just massive feeder, but a problem really for care and compassion for the patient. And I think that's why I didn't go into medicine. I lived above a doctor's office in college, and she told me, she's like, listen, she's like, unless you really, 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 really want to do this every day and help people and incur a ton of debt, like we don't get to practice medicine the way that we used to. And that was 2006,
Wow.
2005, sorry. Um, you know, but I look at it this way, like there are a lot of great clinicians out there. There are. I think the administration, I think we have a problem there in how they're operating these facilities and these big institutions. And I don't know who their customer are at the end of the day. Maybe it's their board, maybe it's their shareholders, but I think they've really lost touch with the patient themselves. And much like the chapter in your book, you had that CEO, right, from a hospital that said, "Thank you for your business," or something like that. It's wild.
Yeah, I was a senior executive, and yeah, it's and I've talked to him about things, and one thing, I live in Texas, and so one of our conversations was about the cost of antivenom. If you get bitten by a snake, which happens in Texas, it's $5,000 per vial. If you leave Austin, go 250 miles south and cross the border, it's like $250 a vial. And so it's 20 times more expensive on this side of the Mexican border than it is the other side of the Mexican border. And we're not talking about some guy in a shack with rusty needles, injecting you, with things. We're just talking about the raw antivenom. And the one thing that's abundantly clear in talking with this fellow, with the senior executive, is he has no he has no intention, he has no motivation to reduce cost. He's all about increasing the multiple, working with carriers to increase his multiple of Medicare that he gets reimbursed for by Blue Cross or whoever.
It's extremely problematic. So over my shoulder, you'll see a poster. There we go. Of it's patient rights advocate. They had a concert recently with the Foo Fighters. Dave Grohl was supporting their event, and all about transparency. So it's like 2016 going into 2017. I get a call from this lady named Cynthia Fisher, who is running patient rights, and she's like, "I'm working with the current administration. Donald Trump's a friend of mine. I'm working towards a hospital transparency rule. And I heard you guys are doing this thing called direct contracting. And ultimately, what we uncovered was, and it's really no surprise, you could go to an orthopedic surgical center and run it through insurance and maybe pay 50, 60 grand. Or you could do a direct arrangement between the employer and the facility, and like all in, still to this day, a knee replacement's maybe 20, 21 grand, right? And in that, we waive the deductible for the member. We give them a cash bonus maybe for making, a purchasing decision. But anyway, she flew down and met with us. And then a short time after, one of our clients, she brought down to DC and was there at the signing of the hospital transparency law. So I'm a big fan of Patient Rights Advocate and what they do,
Yeah.
and continue to do, and will support them. And it's cool to have played like a little part in trying to push, the envelope in the system. To this day, like 60-70% of hospitals are still non-compliant with posting their pricing, which is unfortunate, but slowly we're improving. I tell you this because not only were we doing that with surgeries, but we were doing it with prescription drugs as well. Hence your story, where we were finding different sources to save a buttload of money. And I won't name the entities, but because we were promoting this, we got a cease and desist, not only from a major Blue Cross Blue Shield, but also from a pharmaceutical company. A threat, essentially saying, you guys need to stop doing this. And in the case of the Blue, they actually pulled our appointment at the time to be able to do any business with them and represent our clients as a penalty. And then educated the local competition that we were bad, that we were somehow, bucking the norm and putting patients in danger. Like, it was the most asinine 12 months. And then finally, they hired somebody over there that gave us our appointment back at the time. But this is the problem. I said there's a lot of status in the status quo. You know, it's nothing for them to walk into an advisor and give $1 million bonus check at the end of the year because you've kept all the business with a certain insurance carrier. That to me is problematic. That tells me that you're conflicted and you can't even act as a co-fiduciary, let alone call yourself an advisor if you're giving that bullshit type of advice. Am I a capitalist? Absolutely. Do I want to make money, take care of my family and kids? Yeah. But I want to be able to look at myself in the mirror every day and say, I'm doing the best that I possibly can to impact people's lives. By virtue of doing good, we're going to do damn well and continue
Yeah.
to do well. So I hate to get all passionate and soapboxy,
No, no.
but this is what gets me up in the morning.
Well, in the example that you gave, where if you go through the system, a knee replacement is 60 grand, but you can directly go get it for 20 grand, that gives you 40 grand to do all sorts of things with.
Oh my God, think about how much money the system could save if you just negotiated directly and didn't rely on these other entities to give you this like facade of a deal that you can't even prove with the data that they give you because they won't give you the effing data. So all that being said, you know, it just, people need to start questioning what they're being told. They need to be open to listening to a different story. The problem is it's hard. It's easy to be complacent. Continuous improvement, it's a little bit more challenging, especially in this topic where people have these blinders on. But I tell you, on the other side, there's so much opportunity. Now, the DOL, because the DOL loves HR people and loves employers, has thrown all these responsibilities, not on the vendors, to be honest, for the employers to take fiduciary duty and responsibility seriously. But
And this is where benefits DNA comes in.
we do. We educate employers. We do the audits from a compliance perspective and help them avoid what's going on with like Johnson and Johnson right now. Employee has sued them for fiduciary breach. And now the Mayo Clinic, as of this past week, has been sued for breach of fiduciary duty and how they're managing their plans. And in that case, there's actually charges of RICO,
Wow.
racketeering, like crazy to think about. But if you control markets, right? And you're breaking a number of consumer protections, you know, rules and laws, like how is it not RICO?
Yeah.
Not
Yeah.
for me to decide. We'll leave that up to the judge and the jury.
Well, at the end of the day, it's what's been being done has to be broken up. And the story that you told about Blue Cross Blue Shield coming in and pulling your access and then what sounds like slandering you, um that that's just insane. And it's it's disappointing. I mean, and I'll tell you right now, Blue Cross Blue Shield, I alerted them to straight up fraud in my healthcare. It's somebody that never provided me oxygen, charged Blue Cross Blue Shield for oxygen for 2 years. And I had to hire a lawyer to get them to go away. I kept trying to call them and say, hey, I've never been a patient of yours. Blue Cross Blue Shield, they they've happily been paying. And as far as I can tell, my best guess is there were some rule changes during COVID, and I my best guess is they had an insider, they had an inside agent in the hospital that faked a prescription that for oxygen, for portable oxygen when I was getting ready to go on the ventilator, and at that time the rule didn't require that I sign for the equipment,
Mm,
and so
knock it through.
they billed me and my insurance company for 2 years for oxygen that I never received.
You know, it's wild how much FWA fraud, waste, and abuse goes on. And I'm on another podcast coming up, Stacy Richter's podcast, Relentless Health Value, where we talk about what's hidden in the claims wire that happens every week. And it's just asinine. You know, one of the newest members of my team, Paula Siegel, she has a deep knowledge not only of advocacy, but also coding. So we were joking, I was going to create a system called Paula, Patient Assistance, Upcoding, and Legal Analysis, because she's reviewing claims now. And like 50% of claims have an issue with them. Or there's questions that should be asked. But the way it's set up now, it's just claims hit a system, in most cases, auto adjudicate without any real oversight.
Yeah, that's crazy. Well, hey, you know what? We could talk forever on this, but we kind of got to wrap up. The Do you help individuals or do you only work with businesses?
So we work with businesses. We work with plan sponsors, both employers and Taft-Hartley funds, non-federal government plans. And then we do, a lot of work with, I'd say, stakeholders, different vendors and things like that on some niche work. But by virtue of working with them, we're maximizing impact because typically those organizations represent hundreds, sometimes thousands, tens of thousands of lives. So that's really our goal at the end of the day. But if somebody picks up the phone and calls me, just just my nature and the team that I've hired, we try to help them, like that gentleman with his kiddo that got that DMD,
Yeah.
diagnosis.
Yeah. So for a business that's listening to this that has a group plan, why should they reach out to you?
Have a conversation. Listen, I look at it this way. If I can help educate somebody to ask better questions, right? That's a trickle down effect. That's a rock in a pond. That's a ripple that could potentially expand. If we get their business, awesome. I'm not owned by private equity. There's no venture capital. We've self-funded the whole thing. There's nobody beating on my door saying you need to generate an ROI from your clients and go out and beat down people's doors. I want to help people. And if you're one of those people that's like, maybe I should dig a little bit deeper, we're here.
And so some of the benefits are, one, you may end up saving them money. Two, you can keep them out of lawsuits for violations of fiduciary responsibilities. Is there what else?
You can feel good about your plan. I
Yeah.
think that's what people miss in this whole equation. Benefits should benefit people. Why
Yeah.
offer a plan if it doesn't benefit anybody? It's not going to help you attract and retain folks. So if we could save money, keep you compliant, and make the benefits actually enjoyable, that's a win. We have a cool program with a couple of our clients where just by engaging with a maternal fetal medicine expert one time a month for 30 minutes over the course of the pregnancy, at the end of that L&D, when that baby's delivered, we give you free wipes for a year. I'm sorry, free diapers for a year. So as somebody that wiped a 2-year-old's tushy first thing this morning, free diapers is a big deal.
It's a
And
huge
there's a
deal.
reason why we offer this program regarding high-risk pregnancy and how hospitals jack up NICU rates and get huge reimbursements because, well, nobody questions NICU claims. They should. We have $1 million one that we're working through right now. But ultimately, those are the three things if I was going to summarize, Craig.
Okay. And how did people reach you?
You can go to wefixyourhealthcare.com or you can go to benefitsdna.com or just look on LinkedIn. I'm in a lot of places.
Yeah. Well, Justin, thank you for your mission. Thank you for it's a broken system that needs people like you fixing it. What we're doing, bottom line is what we're doing is not sustainable. It will break. If we could argue it's already broken. And thank you for being part of the solution. Thank you for telling it on Leaders and Legacies.
Thank you for giving us a platform to talk about the issue. I appreciate it, Craig.